Hello everyone, and welcome to our webinar about undergraduate medicine and dentistry. Thank you very much for joining us today. You'll be happy to know that the sun is shining in Dundee's sunny, Scotland's sunniest city, i.e. Dundee. So we're lucky enough to have myself and my colleague Steph from the international recruitment team. We are here to answer any questions that you may have. Please feel free to pop any in the Q&A. You can find that at the bottom bar in the Q&A section with the two speech bubbles. I'm also joined by my colleagues from the School of Medicine and Dentistry, and they're going to give roughly about a 15-minute presentation on respective subjects. Again, please feel free to ask any questions. Me and Steph will try our best to answer any questions that are generic or about the university in general, and then we'll try and field questions towards David and Fiona at the end of their presentations. So without further ado, I'd like to introduce David Russell from our School of Medicine, who's going to share some slides about our undergraduate medicine course. Are you ready, David? Just unmute yourself.
Yep, thanks very much. And I'll just... Okay.
Excellent.
Can you see that okay?
Yep, that's great.
Okay, is that okay?
Yep, that's it, perfect.
Okay, thanks very much for joining us, everybody. My name's David Russell. I'm the international lead for the School of Medicine, and I'm delighted to meet you all virtually. And thank you for showing your interest in the University of Dundee as a great place to study medicine. So today I'm going to go through a little bit about Dundee and why it is such a great place to study medicine, give you a little bit of advice about our admission cycle, and our curriculum, and also what studying medicine in the UK allows you to do. The first thing I should say is that this is based on our normal cycle of recruitment, but obviously with the COVID-19 situation that's taken place around the world, things may need to change this year, and unfortunately we are still waiting for information from the government to make those decisions. So what I'm going to describe to you today is what we would normally do, but that may be subject to change, and obviously we would keep that communication going and let you know about any changes as soon as we have that information. So first of all, just a little bit about the University of Dundee. In the northeast of Scotland, it's a relatively new university, officially becoming a university in 1967, but it punches well above its weight on both the national and international arena. A lot of really good scores for student satisfaction, and in fact in 2020 we are the university for the best student experience in the whole of the UK, something we're really proud of. So a lot of good rankings that we have, and the picture that you can see of graduation, these are actually some of our medical students who graduated a few years ago. So this picture here is actually at the back of the medical school. So one of the really unique things about Dundee, and one of the particular areas that students really value, is that the medical school is actually situated within one of the largest teaching hospitals in Europe. So Nine Wells is an 827-bed hospital. We also have acute psychiatric units and some satellite hospitals which are smaller. So there's a vast array of clinical opportunities for students who study at Dundee. And because in the hospital it really is split into some different areas. So within education, we have the medical school, but we also have the world famous Centre for Medical Education. We have some of the most advanced simulation facilities in Europe, and an area that's obviously very busy at the moment, we have a very active public health department. We also have very active research. Particular areas of expertise are diabetes. So we at Dundee publish more papers on diabetes than anywhere else in the world. We also have a very big drug discovery unit, clinical trials, which is shared between the university and the NHS. And actually, we are currently undertaking the first COVID-19 drug trial in Scotland. We're also world leaders in big data. So in Scotland, we keep all medical data. So we currently have complete set of medical data for over 1 million people that goes back for the past 35 years. And that data is used to recruit people for clinical trials. We can do a lot of analysis of big data, for instance, looking at postcode and asthma kind of incidents. So we can do a lot of research without actually having to look at actual people. So really, a lot of students, if you ask them why they want to study medicine at Dundee and why they chose Dundee, one of the most common things that they'll say is because it is actually located within the teaching hospital. We have an open doors policy, so we have lanyards for our students that identify them as medical students. And as long as they check with the nurse in charge on a ward, they're able to go onto the wards and practice their communication skills, clerking in patients, taking medical histories, so they get lots of opportunity. So in the actual medical school, where our medical students are taught, these are some of our facilities. So you can see a large lecture theatre here. This was created in a recent phase of refurbishment. The pod-like arrangement at the front, that's because we use a thing called team-based learning. And these pods are designed to get small groups together where they can work on projects together. We have great library facilities. Most of the stuff that we use now is online, so not that many books. Communal areas, really in the heart of the hospital, and medicine, our course is really designed to help people develop their own learning style. So there's lots of small rooms for group work. In the bottom right of the picture that you can see, this room, the walls all close, so you can create little pods where people can work, and then they can come back together into a bigger group. We put a lot of emphasis now on simulation. So we teach people to hone their skills in a safe environment, but it has to be very real. So we have one of the largest simulation facilities, as I say, in certainly the UK and if not Europe. We have a 12-bed ward, we have a high dependency unit, we have a primary care physician office, so a GP practice. And as well as for clinical skills, we also have the same for surgical skills, where we have 2 fully operational theatres, endoscopy suites, and actually in our surgical skills unit, this is where keyhole surgery was developed by Sir Alfred Kucheri. And in the bottom right of the screen, you can see our control room where, so in 5th year, all medical students are given the option to run a ward for 20 minutes. So they go into the ward, we have simulated patients, we use mannequins, nursing staff, and they have a handover with the nurse in charge. And then they will spend 20 minutes running the ward. So it's around prioritization. They have to order blood work, they have to write discharge notes for patients. A patient may suddenly deteriorate, so it's around that prioritization. And this is called the ward sim exercise, and we were the first people to implement this, and this is a really valuable experience. It lets students experience what they will actually be doing for real in just a few months' time after they do this. So obviously medicine is very competitive, and a lot of people want to study in the UK because of the high quality of education. And so this is where our applicants come from. So as well as a lot from the UK and Europe, we particularly get a lot of interest from India and Southeast Asia. They're kind of our biggest international markets. We receive about 2,000 applications each year. As all medical schools in the UK, the number of students that we can take is controlled by the government. So we have 157 places for direct entry into year 1 of the programme, and the medical degree at Dundee is a 5-year programme. So how do we actually admit students? So as I say, we receive about 2,000 applications, and out of those 2,000 applications, we'll actually interview around 800 people, because we want to select the very best people who are going to succeed and, you know, meet the way that we want to develop medical students in Dundee. And out of those 800 people that we interview, we will make around 350 offers for 157 places. So people who we tend to make offers to, they're highly qualified and do well in their interviews, and they will tend to have more than one offer. So we make around double the amount of offers that we have for places. So we have 157 places for medical students. As all medical schools, we are allowed to take 7.5% of that is allowed to be from overseas. So for us, that means we have 13 places for overseas students out of 157. So when you apply for medicine, obviously you have to apply through UCAS. So you need to submit a personal statement, and we also look at your exam results. Now at this stage, we don't look at your personal statement. We look at your exam results, and you will also have to take the UCAT. Now we don't publish a required score for UCAT because you have to do it in the cycle that you apply, and you're being compared to everybody else who's taken it in that cycle. So we don't set a grade that you have to get. However, for people who were selected for interviews a couple of years ago, the average score for UCAT was 2,711. So that kind of ballpark figure. So what we do is we look at your exam grades and we look at your UCAT score, and we use both of those to calculate an academic score. Now, if you are applying from school, we put 60% emphasis on your exam grades and 40% on your UCAT score. If you are applying from university, then we swap that round. We put 60% emphasis on your UCAT score. If you have to take IELTS, then that is kind of a tick box exercise. It's not included, your score isn't included to calculate your academic score. And if you do have to have IELTS, then we require you to have a minimum of 7 in each component. So if we select you for interview based on your academic score, so the calculation of your grades and your UCAT, then we will consider your personal statement at interview. So what we look for in personal statements, we want to get an idea that the person is a balanced individual. So they're not just all about study. One of the things to think about is the people who tend to apply for medicine, they tend to be the high flyers in school, the people who never struggle, they've never failed an exam, and they're highly performing individuals. However, when they start medical school, they are with 157 people who are just the same. So we want to see some evidence that people have got some kind of mechanism to help them cope. They've got an interest outside of academic study. For experience, we know that it can be difficult to get experience of shadowing a doctor in a hospital. So we don't officially require it. However, we would expect you to have made some attempt to understand what being a doctor involves, and to be able to explain why you're committed to studying medicine. So if you are lucky enough that you've managed to get quite a few experiences, as some people do, it's very important not just to list them all, because that doesn't actually tell us anything. What we would want is just to pick 1 or 2 and try to demonstrate what you've learned from it and why it's confirmed the reason you want to study medicine. So basically, from your personal statement, we want an idea that you're a well-adjusted individual who can demonstrate why you want to study medicine, you like people, and you understand basically what a medical career entails. And in the interview, we will ask you about that. So we use multiple mini interviews, and this gentleman here is Professor Ronald Harden. Now, he set up the Centre for Medical Education, which is in the medical school and still exists. And he said many, many years ago, so Professor Harden is really the father of medical education. and is world renowned as an expert, particularly in assessment in medicine. And what he said many years ago is that traditional types of assessment are not really suitable for testing the kind of practical skills involved in medicine. And so he developed a type of assessment called an OSCE. And the graphic on the left-hand side gives an idea of what an OSCE looks like. A set of time stations where you're observed interacting with a patient in a clinical environment, and assessed on a various set of skills, which can include things like empathy, communication. So really the kind of extra things that it's difficult to test in a written exam. So Professor Harden developed these OSCEs, and in McMaster in Canada, they thought, well, we could apply this to medical admissions. Can we use something similar? So MMIs were officially started at McMaster University in Canada, and they were based on the OSCE format. Dundee was the first in the UK to implement them, and now pretty much the majority of medical schools would use MMIs for admissions. So why we use MMI? So it creates a huge amount of data. Our MMIs are 10 stations. Each station lasts for 7 minutes. Each station will test 3 different domains. Now, when I talk about a domain, that can be communication, teamwork, empathy, moral reasoning. And so we get a vast amount of data. So we get 30 domain scores for each applicant. It's very reliable. So we use a test called Cronbach's Alpha. And a Cronbach's Alpha score of 0.7 and above is classed as being a reliable assessment. And our MMIs always come out at over 0.8. We also use psychometric analysis, which is called rash modeling, and that's where we look at data in all different ways using different anchor points that allows us to normalize the data to ensure that everybody has been treated fairly, no matter when you were interviewed, because our interviews last for 5 weeks because of the number of people that we interview. So if you can imagine 800 people each having to sit an MMI of 10 stations, it's a really big exercise. Another reason we do it is people who perform well in MMIs tend to perform well in OSCE because it's kind of a similar format and using this, it tests the same kind of skills. But from the candidate's perspective, really probably the most important part is because it's 10 different stations, if a station doesn't go well, you don't really have much choice but just to kind of put that one to the side and move on to the next one. So they get a chance to recover. And you can do quite badly in a station and do well in the other stations and receive an offer. So if we invite you to interview at Dundee, your academic score is put to the side, and whether we make you an offer or not is really around your performance in the MMI. So if you're lucky enough to get a place with us, then this is what our curriculum looks like in the first 3 years. So in year 1, we start off with the principles block. And that's really the kind of basic science, an introduction to anatomy, to make sure everybody's kind of at the same level. Depending on the background, people might not have done the same amount of science, so it just equalizes everybody before we start purely into the clinical work. In terms of anatomy, we are really lucky that we still do full body dissection, and we use teal cadavers, and these are soft embalmed cadavers, so they're really flexible, very realistic. The tissue structure keeps its form and its color, so it's a much more a much better environment than the different kinds of cadavers that other medical schools use. And we're still the only medical school in the UK that is completely moved to teal cadavers. And it's a real, our students are really lucky and value the experience that offers. So we have a systems-based approach. And when I talk about a system, I'm talking about respiratory, cardiovascular. And when we do each of those, they're self-contained. So when you do cardiovascular block, you learn the anatomy of the cardiovascular system. You learn the clinical examinations that you'll need to be able to do and to look at cardiovascular history. You learn about the drugs that are used for cardiovascular disease, and it's all self-contained. And you will see patients who have cardiovascular disease, and in our simulation suite, you will learn how to hone all those skills. And then you will move on to the next one. Every so often, you'll see a thing called CLASP, and this is clinical applications of scientific principles. And these are points in the curriculum where we just pause and we try just to link each of the blocks. So although we teach them as individual systems, they are all interlaced, and we use these weeks just to get you to think about the bigger picture. We have things called SSCs, so these are student selected components. The GMC in the UK say that 25% of your medical curriculum should be self-directed from the students. So SSCs allow people to undertake small projects, learn skills in particular areas that are of interest to them. So it allows people to think about the areas that they want to go into in the future and to develop those skills. We give students very early clinical experience. So students will meet their first patient in week 1. Which is unlike most medical schools where you will do some basic science and then you move on to the clinical. We give you clinical experience straight away, and we use clinical exposure as a way of embedding knowledge. So you will learn the theory and then you will see it being applied in the clinical area. And our students really value that, and it's quite different to what most medical schools would give you. So after you've done your first 3 years, you have a transition block. So transition block allows you to, although you've had quite a lot of clinical experience, transition block allows you to develop the skills that you need to really go in and work in a clinical environment. So transition block covers how to scrub up for theatre, how to use the IT systems that they use in clinical practice. Because you will be spending a lot of time in clinical areas where you will have a role, you need to be able to do things like recognize a patient who is deteriorating suddenly, and we make sure you've got advanced life support skills. So it really gets you ready to go into clinical placements. In year 4, you do some rotations. They tend to be around Tayside a little bit more, and you do these core clinical placements. So medicine, surgery, child health, psychiatry, etc. And then in 5th year, so at the end of 4th year, actually, you sit your finals. So these are your final knowledge-based exams, and then you go into 5th year, and really 5th year is about preparing you to be a working doctor. And so we call them foundation apprenticeships, and this is where you really work with foundation doctors, and you also spend time in GP practices, you do some SSCs, and also we give you the chance to do an elective. So you can go anywhere in the world to experience medicine in a different context. We also actually in 4th year have the opportunity now, and we are the only university in Scotland who offered the chance to do a longitudinal clerkship. So you can go out into rural Scotland and you can spend the whole year out in the community working with the community teams, local GPs in the smaller hospitals, and then you just come back to Dundee to sit your exams, and that's quite a popular option for people. Now, once you graduate, now no matter where you come from in the world, you, with a medical degree that's obtained in the UK, you are eligible to apply for foundation training. So you will receive a provisional registration with the GMC, and that allows you to apply for foundation programme. So you do 5 years at medical school to obtain your primary medical degree, and then you have your 2 years of your foundation programme. At the end of your FY1, you will receive full GMC registration. So at that point, some students from overseas will take the decision to go back home, but they have full registration with the GMC, which is a good thing to have. It allows you to travel quite easily. A lot of countries recognise GMC registration. And if you want to come back to the UK at any time, you don't have to sit any additional exams. you can come back into the UK if you have a job. The foundation programme is competitive and it's UK-wide, so you wouldn't automatically just be placed in Scotland or in Dundee. We calculate a score for people based on their academic performance. There's also a national exam that people have to sit called the situational judgment test, and that makes up 50% of your application. And you must have passed the prescribing safety assessment that's run a national exam as well. But when you go into foundation training, it is paid employment, so you are working as a doctor, and you will require a Tier 2 visa, which is sponsored by the National Health Service. Now, at the moment, there is discussion about the introduction of a national licensing exam. Now, it was meant to come in 2022, but the last I heard, it's been put back to 2024. So this will be an exam that's set by the GMC, and it will be delivered by medical schools, and it's meant to ensure that medical schools all are producing doctors to the same level in this exam. So it will come in, but as I say, the last I heard it's be 2024. When considering a medical school, all medical schools are governed by the GMC, so we all have to meet the standards that are set by the GMC, and they have lots of information on their website about what you will study at university. The difference comes from the way that we provide that training. But in the GMC website, if you actually go in, so at the point of FY1, so after you've graduated from medical school and you've done your first year, at the point where you get your full registration with the GMC have a survey that they send to all foundation doctors in the UK, and ask them lots of questions, and you can go in and you can filter and you can have a look. But one of the questions that it asks is, how well do you feel that your medical school prepared you for being a working doctor? And although it is quite small probably on the screen, but in this one, if you look, this is all the medical schools in Scotland, and Dundee ranks first and has done for many years and continues to do. The data is always, it takes them a while to collate it, so it's always a little bit delayed. So we prepare our doctors well for practicing in the clinical world. And if you look, although this is much more difficult to see, this is now looking at all medical schools in the UK, and we are consistently in the top 5. Usually it varies between first place to third place. So we are a really good preparation for our medical students. So that can be, when looking for information about medical schools, the GMC website is a good source. So I think that's just to finish off with a quick summary of why Dundee really is a great place to study medicine. The satisfaction our students have with the course through the National Student Survey is very high. You know, year on year, our students say that they're very satisfied. Our early clinical exposure is quite different to what most medical schools provide. So students really meet patients very, very early. Our use of simulation, we're very, very well known, world renowned for our use of simulation. And student choice, so we provide our students with a lot of choice. So we can give you lots of different places that you can have clinical experience, and we allow you to choose where that you go. An interdisciplinary approach. At the beginning, I spoke about the research opportunities, the clinical trials. Students are encouraged and able to get involved in all of that. So you'll get a lot of experience. You know, medicine is changing. It's not all about face-to-face consultations. It's about big data. It's about public health. All the different areas, you know, particularly that we're seeing around COVID-19 at the moment. So our students are well prepared to meet all of those demands. And from the GMC data, you can see that our students are very well prepared for clinical practice, which is probably the most important test. You know, we are in the business of creating doctors, and that data hopefully can show you that we do a really good job. So I think that's the end of my presentation. As I say, at the end, we're happy to answer any questions that we can. So thank you very much, and I look forward to, you know, receiving applications, discussing with them in the future. It really is a great place to study medicine, and I will stop sharing now and pass on to somebody else. So thank you very much.
Thank you, David. That was really informative. Could I ask that Fiona, you share your slides, please? And unmute yourself if you can. I'd say we do have plenty of questions, David, so be prepared. Excellent, thank you, Fiona.
Okay. Thank you very much for taking the time to listen to David and I talking about medicine and dentistry today at Dundee. David has covered a lot of the reasons why you might want to come to Dundee itself, but the dental school specifically has got a really good global reputation and features highly in many of the league tables each year. I think for undergraduates, the fact that we're first in the UK for dentistry in the National Student Survey is really important, because that survey is the result of our students who are just on the point of graduating, and they do a survey about their whole experience of the course. And we consistently are in the top. We're usually 1, 2, or occasionally 3 in that survey. Another important one is the International Student Barometer for many of your clients, and we consistently rate very highly in that one as well. Now I'm going to talk in reverse to how David did, and I'm going to talk about the course initially, and then I'll talk about our entry procedure. So the dental school in Dundee is relatively small for dental schools. We take in just under 60 students each year. The school itself is located in the middle of the university campus, right on the edge of the city centre, so it's very accessible, and it has much of the student accommodation right on the doorstep. That's in terms of student residencies, but also the university library, the Students' Association, where many of the clubs and societies are based, and also sporting facilities are on the doorstep as well. We've got a really good support system with the staff and students, and I'll talk a little bit about that a little bit further on in this presentation. We started a new curriculum 2 years ago now, and every dental school in the UK has to teach the same things. There are certain outcomes that we have to prepare students to graduate and enter the profession of dentistry. But what varies between different dental schools is how these things are taught. And so our new curriculum is called the 4D curriculum. It's Dentistry at Dundee, driven by discovery. And the aim with this is to provide early clinical experience for our students, plus to develop the students' abilities to do independent learning, to be reflective, and to be lifelong learners. So these are really important things in professions such as dentistry and medicine, in fact. And the curriculum has different kind of strands to it. We are aiming to ease the transition between people who leave school to becoming an undergraduate dental student, and then the transition on to graduate work as well. And we're integrating the teaching of science and clinical work so that both are mixed throughout the course. There's not the traditional curriculum where there would be 2 years of science teaching and then 3 years of clinical work. That's all integrated throughout the course. And there's a lot of new innovative teaching methods to improve communication skills and there's self-directed learning in this as well. And so the students are, they're really learning rather than us just telling facts in lectures in a more traditional curriculum. There are new methods of assessment that we use, and we use a lot of quite innovative technology as well during the course. So the approach is that the students learn things just in time. So, for example, if they're going to be learning how to give local anaesthetic, then the students learn the anatomy around that first of all, and then they go straight on to learn how to administer anaesthetics. Whereas, again, in a traditional curriculum, they would be doing the anatomy initially, and then they would come back to anaesthetics quite a while down the course. There are also theme-based learning journeys. So following the clinical situation of a patient as that develops, and they look into it in more depth as time goes on, and they revisit this case as it becomes a little bit more complicated as time goes on when they go back to it. We have I classes rather than lectures, so they're interactive classes, and there's a lot of small group work as well. And we have similar facilities to the medical school when a year can divide into small groups and do independent work and then come together and bring the whole thing into one. We have worked very hard to engage the students, and so from the second week after they commence the dental course, they are in the clinical environment. And initially the students will be learning how to keep the clinical area clean, and that's, you know, of particular importance with cross-infection control being extremely topical at the moment. So that's one of the first things that students learn about, and then they put that into practice in the clinical area. And really, it's what would be traditionally called a spiral curriculum, in that the students will revisit topics and cover them in more depth as they come back to these topics throughout the 5 years of the course. And this is just a graphic to show a little bit about how the course runs. So the course is 5 years long. There are 9 modules. 2 modules each year up until the final year, and the final year is all 1 module, and it's mostly clinical work. But you can see various little pictures, and the pictures are similar through different years, but the picture of a dental chair and of more teeth is the focus more towards clinical work, and the students will spend almost all the time doing clinical work in modules 7, 8, and 9 as things progress. There are innovative ways to learn, and some of the anatomy teaching is done with the teal cadavers that David was talking about. But that is then put into practice by the students working with medical illustration artists, and they draw on the muscles and the blood vessels and the nerves that they've learnt in anatomy, and they draw it doing face painting on each other. And that just helps consolidate some of this learning. And I was mentioning technology and the use of that. And we use quite a number of different innovative methods to teach, and for the students to practice. This is giving local anaesthetic. We have a simulator that they can practice on as well as practicing on the teal bodies. We have a clinical skills area, so the students all practice various techniques in the clinical skills area before they're allowed to do these on patients, which is probably quite reassuring for any of you who are patients. And the students keep revisiting the clinical skills area and learn more complex techniques and pass a test in that before they're allowed to do that on patients. In first year, the students have a discovery week, and this is their opportunity to look into sometimes quite obscure elements related to dentistry, and they will then do a presentation on this at the end of the week. And it always surprises me how innovative the students are when it comes to this, and they really thoroughly enjoy that. And they, you know, so there are quite a number of fun aspects to the course, because it's you know, it's a tough course, undoubtedly. So we need to make it fun as much as possible for the students. We have a lot of really high-tech equipment in the dental school that the students have the opportunity to use and experience as well. So that is all kind of cutting-edge techniques and equipments that we have. I mentioned just before about our student support system, and there are a number of different inputs to this for each individual student. The students are allocated an advisor of studies who will see them 3 times during their first year and 2 times each year after that. And the advisor of studies will help them if they have any issues, or direct them to other places where they can get the help if the advisor cannot help them directly themselves. There are also student welfare ambassadors who some students prefer to approach in the first instance, and the students are also buddied up with other more senior students. So it's a very supportive environment. The staff have an open doors policy for students who are seeking for any help or advice. And there is also a huge amount of support within the university as a whole for all of our students, both undergraduate and postgraduate. Again, this is just a clinical skills area, just to show you a little bit more about what is available for the students to practice on. And they have the same drills and hand instruments as you would use on actual patients. So the students get very familiar with the handling of these things before they do them on patients. We also have laboratory facilities, and the students will carry out some of the laboratory work for some of their patients as well. They'll make false teeth, they'll make crowns, bridges, dentures, and things like that for their patients. So they'll do the clinical work and the laboratory work, and that's a very useful way to aid understanding and learning of these procedures. The students all work in different clinical areas to do different aspects of dentistry. This is one of the clinical areas that we have, and the students work, they each are allocated to a chair, and they see their patients there under the supervision of the members of staff that are on the clinic with them. So moving on to the selection of students, like medicine, the entry is competitive. We have fewer applications than medicine, but then we have fewer places overall for the students. So there are about 7 or 8 applications per place. But you do need to remember that students will apply to a number of different dental schools. So actually, the chances of receiving an offer are a bit more than you would initially think when you look at that figure on this slide. Our aim, however, is to minimise dropout, and we really have a very, very low dropout rate. We lose less than 1 student each year. So, you know, the dropout is absolutely minimal. But we're looking for students who are motivated to study dentistry. They do have to be hardworking, and they have to meet high standards in academia, but also they have to have a professional attitude. And dentistry, a huge amount of dentistry is about communication with patients and colleagues and members of the dental team. So these are really important factors. In terms of getting in and the non-academic requirements, we expect students to have undertaken some form of work experience. And it's really so that candidates have made an informed decision that dentistry is a career that they want to follow. We usually recommend that candidates shadow their own dentist. That's ideal. Some manage to organise shadowing elsewhere as well, but we are quite happy if a candidate has done their shadowing with their own dentist, and that would be absolutely fine. Ideally, we would suggest 2 weeks is sufficient time to do this, and that can be spread out over a long period of time. Some candidates choose to spend a couple of hours with their dentist once a week after school. That's quite a popular way to get work experience done. We're also looking for students who are good kind of all-round students and would be good members of the student community. And I think it's really important that students come in with other interests other than just academic interests. Dentistry is quite an intensive course, and I'm a great believer that students should have some form of safety valve to relax when they're not studying. And although I'm saying dentistry is a tough course, it is, but it's not impossible by any means. And actually, if students just keep up to date with the work, then they should be fine going through a course such as dentistry. In terms of the reference, we are looking at a reference from, usually it's from someone at school, and it should include how prepared they think the applicant is for studying dentistry. Now, most of our applications are done through UCAS with the closing date of 15th of October, the year before candidates wish to start. The last couple of years, we have opened up applications after that just to maximise the quality of candidates that we have. We did that last year and got a really high quality of candidates, so we did it again this year. There is no guarantee that that would happen in the future, but so it's as candidates are as well to apply by the UCAS deadline if they can. In terms of entry requirements, I've just listed A-levels and IB here, but for other international qualifications, then if you consult the Dundee University website, then that lists all the entry requirements for different countries. Our essential subjects are biology and chemistry, and that would be in the vast majority of international qualifications that candidates might be doing. Similarly to medicine, we have an IELTS score of 7 as our requirement, with a minimum of 7 in each section. And this is a requirement of the General Dental Council in the UK. The UCAT test, similarly to medicine, needs to be completed before the UCAS application is made. The whole situation with COVID-19 at present, we are awaiting confirmation of testing for 2020. Testing might start a little bit late this year. There might be slight variation in format. We're just awaiting confirmation of that and don't have any more information at the moment, but we'll be ensuring that candidates are kept informed as soon as we are informed by UCAT. However, it's really important to prepare for the UCAT test, and there are many practice tests on the UCAT's website and on their app, and I would suggest that candidates do these under timed conditions just as a suitable preparation for the test itself. There are various books and courses that some people do. Some say they're valuable, others don't. I would suggest that there are actually, there's more and more practice tests available on the website, but candidates can feel free to use books and courses as well if they so wish. You're only allowed to do the test once in each cycle, so candidates really should prepare as best as possible and do that when they are feeling fully prepared in the UCAT test. We don't have a cut-off score for UCAT. We just compare the scores with other candidates in the entry cycle. So our average scores can vary a little from year to year. The average UCAT score for the invitation to interview this cycle was 2,363, but last year it was about 100 marks higher than that. So there is a bit of variation just in the scores year to year. We do the same MMIs as the medical school. Again, there's so much uncertainty at the moment. We are just waiting more formal government advice to see whether we are permitted to do MMIs in their normal format this year. If we have to change them, we'll be notifying candidates and agents and everyone as soon as we have any information to pass on. However, exactly the same as medicine, there are 10 7-minute stations. There are a variety of types of stations. Some are one-to-one interviews, some are discussions on set topics, and some involve role playing. And after the MMIs, we make offers based on a ranking list of performance at MMI. So once we have done the MMIs, we put the academic performance to the side and we just use the MMIs for selection for offers. We use exactly the same principle as the medical school. So we use academic scores and UCAT in the same proportions to draw up our list of candidates to be invited to the MMIs. Just to finish off, I just wanted to run through the application timeline. So as I said previously, October the 15th is the deadline for applications via UCAS. We hold multiple mini interviews in Dundee and in Kuala Lumpur as well during the winter months. And in March, we make our offers to our candidates prior to the course, usually starting in September, although it's starting just at the beginning of October this year. It can sometimes be helpful just to have some stats. So this was for entry last year. We had 57 places available, 429 applications, of whom we interviewed 276 and made offers to 129. Of the places we have available, around 13 are available for international candidates. So we have a larger proportion. We have about 20% of our intake as international candidates. We don't have the same stipulations as the medical school have that dictates how many they can take in. And that is the end of my presentation, but I'm sure David and I will both be happy to answer any questions at this stage. Thank you.
Thank you, Fiona. We have had quite a few questions. I should say that we're running a little over time and it is now 11 o'clock, so hopefully David and Fiona can stay for a little bit longer just to answer any of the questions that have come up. So there have been quite a few questions, especially about admissions. But for David, there's a question about what percentage of international applicants successfully get an offer?
Okay, as Fiona also mentioned as well, I mean, we are limited to 7.5% of our students can be from overseas. So for us, that means we've got 13 places. But actually, the number of people who will get an offer is at a higher kind of percentage than it would be from somebody from, say, Scotland, because the number of applications per place for our home students is much higher. Overseas candidates tend to be very well qualified, and they also are not limited to the limited number of applications that a UK student would be. So, for instance, I know one student from the Middle East who we've made an offer to for this cycle who has currently got 7 offers. So we actually make more offers to overseas candidates per applicant because there's more choice for those students. So I don't have the exact figure, but even though the number is low, it's not actually, it's quite a good situation for an overseas candidate who applies.
Thank you. And also, if more, like, so say, like, obviously there's 157 places for students in the medical program. If more people accept their offer, especially this year, say, how does the university deal with that?
So we will have to deal with that. We have dealt with that situation in the past. Obviously, you know, our facilities can cope with more than 157. The reason we don't take more students is because our numbers are controlled by the government. But obviously this year in particular is going to be kind of an unknown situation. So if people do have an offer and they accept it, then we wouldn't turn them away.
Excellent. Another question here, and it's open to both Fiona and David, is that obviously due to the current situation that we find ourselves in the world generally with the COVID-19, is it possible to for the deadline for applications to be postponed this year?
In terms of UCAS applications, that will be dictated by UCAS, and we don't have any control over that. However, as I mentioned, we did reopen for direct applications, and that is something that we'll consider doing again this year, particularly given the circumstances that we've got at the present time. I don't know if you want to comment on it for medicine, David?
I think it would be the same. You know, the UCAS cycle is dictated by UCAS. Obviously, the selection process that we go through is a major exercise that runs from December when we start interviewing up till February and before that. So obviously, depending on if we can run MMIs as they are at the moment, then, you know, obviously the timelines are all going to follow. So UCAS is out with our control, but if the UCAS deadline is going to be late, we may consider direct applications. As I say, we've not made a decision on that. We're waiting for guidance. So unfortunately, there's more questions than answers at the moment.
That's okay. Thank you both for your answers there. Another question for David. You're getting pelted questions at the moment, but just in terms of the foundation program postgrad for medicine, do international students have to do this foundation, or is it just for UK students?
It's anybody who receives a medical degree in the UK is eligible to apply. So if you are an overseas student and you qualify as part, because you've got a medical degree from the UK, you will automatically get provisional registration with the GMC. Now, if you go home at that point, and if you then want to come back to the UK and say in 5 years' time, and apply for the jobs, even if you've done your residencies at home. And if you come back to the UK, you will have to sit exams to be able to come into the UK and practice. So currently the exam is called the PLAB, but they're actually replacing that at some point in the future. My recommendation, and which the vast majority of students do, is that they do at least the FY1 to get their full GMC registration. It's a good thing to have. Not everybody does it, but really I could think in an average year, maybe 1 or 2 students don't do it. Sometimes everybody does it. It is, yeah, I would recommend that it's done.
Excellent, thank you. And a question for both Fiona and David. For students who don't perform well in the A-level exams or any other sort of qualifications that get them into the course, would we accept retake applicants? We'll start with Fiona because I feel like David's answered most of the questions.
Hi, we would normally ask for exams to be achieved at the first sitting of them. There might be a bit of a difference this year. Again, there's just so much uncertainty, and with people using, you know, not actually sitting the exams this year, then we might have to offer a degree of leniency on that for the next year, because I know that some people will decide that they would rather sit exams than go with the grade that they've been awarded without any exams. So that might be an exception to it, but usually it's first sitting of exams that we're looking for the grades at.
And that would be the same for medicine.
Excellent, okay. And also, we'll take another couple of questions. We'll go till about 10 past. So just again for dentistry and medicine, if it happens that students have to do online teaching for the first couple of weeks or so, is there, what do you think will happen in terms of like the clinical part, like for catch-up?
So for medicine, we have lots of online resources for training and clinical procedures that we use as a way of also part of our simulation. So all that would happen as normal, and then students would be, we would put in the clinical parts when the students came face to face. So students would get that experience. We're working on the plans. Again, we're not quite sure of the time frame, so we now know that we're starting in October, which is not that much different than it would usually happen. It's only 2 weeks. If students can't come before Christmas, then, you know, the first block of medicine is largely theory, the first 8 weeks where we do the principles block. So it wouldn't be that much of a difference, but we are modelling all that at the moment.
Yeah, similarly for dentistry, we would be using the clinical skills area, so simulated environment, instead of clinical work if that's not possible. And we are currently anticipating that at least some of the teaching will be done in an online format for the first semester up until Christmas. We are fully aware that there might be an issue with some of our international students getting to Dundee for that part. So we're going to provide all the teaching that is required in an online format, should that be necessary, and we will ensure that any clinical work is caught up once the students are able to attend.
Thank you for that, both. And I think we'll take one last question here. There is quite a few in the open, and we'll try and answer them as much as possible in the answered section. But it's just a question about the UCAT exam. I know you briefly mentioned about it, both of you, but if it does get cancelled, what will be the policy for admission in terms of a standardised test? If there is any.
I think we need to wait and see what happens from UCAT. They haven't indicated that the test is going to be cancelled yet. and I suspect that they will do all they can to run the test in some format or another. Should that not be the case, then we will be looking at alternative means of selecting candidates for interview.
The same for medicine.
Excellent. Thank you. So that is us done with the webinar for medicine and dentistry. I would just like to pass on a huge thanks to Fiona and David for both their very interesting and informative presentations, and also to Steph for answering the questions, and again for Fiona and David for answering the questions as best you can given the current situations. But thank you everyone for attending this webinar. I hope you got as much out of it as possible as you could. But otherwise, have a good day or evening or morning for wherever you're coming from. Thank you very much for attending.